The ICU inside Edmonton's Grey Nuns Hospital has become a place nurse Lisa Gallioni can hardly recognize.
The monitors that are everywhere, the computer stations in the hallway, like walking through the hallways, like trying to weave yourself through a maze without tripping over anything.
The small ward is now treating double its usual patient volume. The ICU packed with incredibly sick COVID patients facing this illness alone.
They're scared, they're terrified, and we're the only ones there to hold their hand. And that is killing us.
Intensive care units in Alberta continue to fill at a chilling speed. Since November 1st, the numbers have increased by 385%.
The numbers of patients with COVID that are hitting the hospital, and particularly the intensive care units, is at a level that I've never seen before in 10 years of practice. The volume is absolutely incredible, and it's only going to get worse.
Alberta's new restrictions took effect over the weekend, but they've come too late to prevent the coming surge. The number of ICU patients is expected to hit 200 by Christmas and will likely keep rising well into the new year.
Everybody who works in healthcare just takes it one day at a time, because if we look at the math, which has been out there for a month now, we know where we're going.
Alberta Health Services has added 90 new ICU beds since the beginning of November and is working to open additional space in the coming weeks. But added capacity comes with a cost. Non-urgent surgeries and procedures have had to be postponed, while across the system, staff are being called upon to work longer hours to cope with the demand still to come.
You're terrified, I think, underneath. Dealing with that, you want to do the best you can for your patients, but there are so many of them.
Heather, Yourex-West, Global News, Calgary.